If you constantly deal with the blocked nose, thick mucus in throat, sinus pressure, or post-nasal drip, this video will help you understand what's really happening and how salt can be used correctly to support your body's natural clearing processes. First, an important point: mucus is not your enemy. Mucus is the part of your immune system. Your body produces mucus to trap bacteria, viruses, dust, mold particles, and other irritants that enter your airways. The real problem starts when the mucus becomes too thick and sticky, making it hard to move. Inside your nose and sinuses, you have tiny hair-like structures called cilia. These act like conveyor belt, constantly moving mucus outward. When inflammation, dry, air, allergens, or infections interfere with this system, mucus builds up, pressure increases, and breathing becomes difficult. This is where salt can help. Salt works through something called osmotic effects. In simple terms, salt pulls water. When you use a proper saline solution, it helps draw water out of the thick mucus, making it thinner and easier to remove. At the same time, salt can help create an environment that is less favorable for certain microbes on the surface of the mucous membranes. However, not all salt is the same. Avoid standard table salt, which often contains additives and iodine that can irritate the sinuses. Instead, use non-iodized sea salt, Himalayan salt, or saline salt specifically made for nasal use. Simple salt water recipe: mix 1/2 tablespoon of non-iodized sea salt, 1 cup 250 milliliters warm distilled water, or water that has been boiled or cooled. The water should be feel like body temperature, not hot, not cold. How to use it? For throat mucus, gargle gently for 20 to 30 seconds, then spit it out. This can help loosen mucus, soothe irritation, and support throat hygiene. For sinuses, use nasal rinse or neti pot. Tilt your head slightly, allow the saline solution to flow through the nostril and outer odor. This helps flush out mucus, allergens, and the debris. Always breathe through your mouth during the rinse and stay relaxed. Afterward, gently blow your nose. You can do this once daily or up to twice daily during the heavy congestion. Additional factor to consider: if mucus keeps coming back, salt alone may not be enough. Common underlying triggers include dry indoor air, very sensitive in some people, chronic exposure to the mold or damp environments, seasonal allergies, or mouth breathing during the sleep. Supporting hydration, improving air humidity, and identifying triggers can make saline reasons far more effective. Important note: this method is supportive, not a medical treatment. If you experience persistent sinus pain, fever, severe pressure, bloody discharge, or symptoms lasting weeks, consult a healthcare professional.